I believe that it's really important event, of course, for the organizing company, but I also believe that this is a very nice event for upgrading our knowledge in different parts of dermatology for all of us who are attending the Congress. I must tell you, I was president of many congresses. I can tell you around 50 already in my career, including European and world ones. But I've never been a Congress president of any company, and this was first surprising me, but at the end I of course realized we have so many common projects together that to accept this offer was really a great honor for me. I can tell you concretely that Pierre Faber started in the Czech Republic, and particularly in my department, so-called School of Atopy, where we really try to teach parents of the patients suffering from atopic dermatitis how to apply emollients, topical therapies, and it is something what is really of help to the patients. You know, first of all, I believe and I know that not all the countries have the same level of healthcare. Not all the countries which are participating here have the same accessibility to all possibilities of therapies nowadays, and to exchange the ideas, to exchange and share the knowledge. It's really how to grow and how to build our future for dermatology, and for that I'm really thankful to Pierre Faber. During this Congress, I would say that some really new data arrived because of selection of really best speakers in the fields. This Congress is not dealing with all dermatology, but there are some focused areas which are first of all of course important for Pierre Faber, which is like combination of pharmaceutical company and also cosmetic dermatological company, if I could name it this way. So on the one hand, we were dealing with infantile hemangioma, which is really serious, let's say, disorder, really worsening the quality of life deeply. On the other hand, we are dealing with even mild forms of acne, let's say, or seborrheic dermatitis, dandruff, things like that. I think what's really interesting here that during the Congress we could find solutions not only from the medical point of view, but also how to combine the therapy with complementary approaches. Like, for example, if you treat acne, you are using drugs, of course, but at the end you must also advise which facial care, which skin care you should recommend to your patients. And if the patient is failing in these additional therapies, even the result of the therapy could be much worse. So I think then we should go to each and every topic. So from hemangioma, I would say we were discussing nicely really the guideline, how to do it, when to start, and for me it was important to know that if we treat patients with inherited hemangioma, we should really start as early as possible. Second topic was atopic dermatitis. I think it was very nice to see that even the most well-known experts in the field were brackets fighting against each other in a discussion how to apply emollient. Can you imagine that biggest dermatologists are not in consonance or are not speaking one voice, how to put emollients on the skin? For me it was surprising, and I still think that clinical practice is very important. We all have our own approach, and to again really to exchange ideas is perfect. So speaking about photoprotection, I think it's really a topic which is very frequently discussed also by journalists and published by media. And again, surprisingly, we are not at the agreement when we discuss photoprotection, because, for example, Professor Harvey Louis explained us that not only the pigment of the skin, melanin, is only of benefit but also had some bad sides of its function. So it was new for me. Then speaking about acne, I already noticed some points, but I must say for me it was nice to have a review of Professor Brigitte Dreno, who explained nicely the results of a great survey did in most countries of mainly Europe, how new type of acne, which is adult acne in women, presented in our patients and how we should treat it. And last but not least, we were discussing also the problems of hair, and I believe that hair disorders are really very popular, and we know that hair problems are really worsening the quality of life of our patients, and they are evaluated like one of the worst among other chronic conditions, even worse than, I don't know, cardiac failure or oncological diseases.
So you think that this Congress was a success, and if next time Pierre Fabre will ask you if you will be again president of a Congress, so you will say yes?
Definitely yes.